I'm Dr. Durgaprasad Reddy, Professor and Head of the Department of Cardiac Surgery at Vaidehi Hospital. Whether the patient is symptomatic or asymptomatic depends on the severity of the valve disease, and then comorbid conditions, whether the heart functions has improved, whether the dimensions of the ventricles have enlarged, and then how symptomatic, that's the most important patient, how severe the disease. We have some gradings of, when you take an echocardiography for the heart valve, some gradings are there. That all shows when a patient should be subjected to a heart valve surgery. And whether he is having one valve disease or a two valve disease. So all these things put together, we need to really work him up and see. Most important thing is see the patient clinically, whether is suitable for a valve surgery or you can wait for some more time. But most of the things, there are certain criteria has been fixed. So once we see the echocardiography, we'll understand when a patient can be subjected to a valve surgery.